questions focused on Lyme disease, with 5 answer choices each and detailed rationales for why the correct answer is right and the others are not. Question 1, Vector and Reservoir. A 35-year-old hiker presents with a bullseye rash after a trip to rural Connecticut. Which of the following is the most likely vector of the pathogen causing his condition? A. Aedes mosquito, B. Ixodes tick, C. Anopheles mosquito, D. Culex mosquito, E. Dermacentor tick. Correct answer B. Ixodes tick, Borrelia burgdorferi, the causative agent of Lyme disease, is transmitted by the Ixodes scapularis, deer tick. Why not the others? A. Aedes transmits dengue, Zika, chikungunya, yellow fever. C. Anopheles, vector for Plasmodium malaria. D. Culex transmits West Nile virus. E. Dermacentor transmits Rickettsia rickettsii, Rocky Mountain spotted fever, not Lyme disease. Question 2, early manifestation. Which of the following findings is most characteristic of early localized Lyme disease? A. Myopericarditis, B. Polyarthritis, C. Erythema migrans, D. Encephalopathy, E. Cranial nerve palsy. C. Erythema migrans. The bullseye rash, erythema migrans, is a hallmark of early localized Lyme disease. Why not the others? A. Myopericarditis, possible in later disseminated stages. B. Polyarthritis, more typical of late-stage disease. D. Encephalopathy, occurs in late disseminated Lyme disease. E. Cranial nerve palsy, occurs in early disseminated stage. Question 3, neurologic complication. A 22-year-old male presents with bilateral facial weakness and a history of tick exposure. Which stage of Lyme disease is most consistent with this finding? A. Early localized, B. Early disseminated, C. Late disseminated, D. Incubation period, E. Post-treatment Lyme syndrome. Correct answer B. Early disseminated bilateral Bell palsy is a classic finding in the early disseminated stage of Lyme disease. Why not the others? A. Early localized, limited to rash and flu-like symptoms. C. Late disseminated, causes arthritis, encephalopathy. D. Incubation, asymptomatic phase. E. Post-treatment Lyme describes persistent symptoms after treatment. Question 4, treatment in pregnancy. Which is the most appropriate treatment for a pregnant patient with early localized Lyme disease? A. Doxycycline, B. Metronidazole, C. Amoxicillin, D. Ciprofloxacin, E. Azithromycin. Correct answer C. Doxycycline is contraindicated in pregnancy and children 8. Amoxicillin is the preferred option in these populations. Why not the others? A. Doxycycline. Avoid in pregnancy due to risk of tooth discoloration, bone growth issues. B. Metronidazole, not effective for Borrelia. D. Ciprofloxacin, not standard treatment for Lyme. E. Azithromycin, not first line, reserved for rare penicillin allergic cases. Question 5, cardiac complication. A patient develops chest discomfort and syncope 3 weeks after tick exposure. ECG shows third-degree AV block. Which of the following pathogens is most likely? A. Treponema pallidum, B. Borrelia burgdorferi, C. Coxiella burnetii, D. Bartonella henselae, E. Ehrlichia chafensis. Correct answer, Borrelia burgdorferi. Lyme carditis, including AV block, is a known complication of early disseminated Lyme disease. Why not the others? A. Treponema causes syphilis, not linked to AV block. C. Coxiella causes Q fever, may affect heart valves, but not AV node. D. Bartonella, associated with endocarditis. E. Ehrlichia causes ehrlichiosis, not AV block. Question 6. Late manifestation. A 45-year-old woman with a remote history of untreated tick exposure now has asymmetric arthritis of the knee and memory issues. Which stage of Lyme disease is most likely? A. Early localized, B. Early disseminated, C. Late disseminated, D. Chronic Lyme syndrome, E. Reinfection. Correct answer C. Late disseminated, chronic arthritis, encephalopathy, and neuropathy are features of late-stage Lyme disease. Why not the others? These stages would not present with long-standing arthritis and cognitive symptoms. D. Chronic Lyme syndrome, a controversial term with vague criteria. E. Reinfection, would present with new early symptoms. Question 7. Co-infection awareness. A 40-year-old man diagnosed with Lyme disease develops pancytopenia and fever. Which co-infecting organism is most likely? A. Rickettsia rickettsii, B. Babesia microis, C. Yersinia pestis, D. Toxoplasma gondii, E. Trypanosoma cruzi. Correct answer, B. Babesia microis Ixodes ticks can transmit Borrelia anaplasma and Babesia. Babesiosis causes fever, hemolysis, and pancytopenia. Why not the others? A. Rickettsia, transmitted by dermacentor ticks. C. Yersinia, transmitted by fleas. D. Toxoplasma, spread via cat feces or undercooked meat. E. Trypanosoma, transmitted by reduviid bug in South America.